My name is Jorge Plutzky. I'm the Director of Preventive Cardiology at the Brigham and Women's Hospital and have a longstanding interest in the intersection between diabetes, metabolism, and cardiovascular disease.
My name is Jane Reusch. I'm a professor of medicine and associate director of our Center for Women's Health Research.
One of the questions I often get is a patient who says, I've lost 15, 20 pounds. I'm now at a much better body weight. And so it's time to stop them, right? What is your counseling to those patients?
I'm an exercise physiologist, and I am extremely worried about cardiovascular health and its relationship to cardiovascular fitness. So when people lose weight on these agents, they lose both muscle mass and fat mass. And when they regain weight, which they inevitably do if they stop these agents, they regain fat mass. And then if you do that a couple times in a row, we really are very worried about a long-term increase in frailty or decreased strength and functional status in people who have lost weight or who have gone up and down. Now, one of the things that we don't know, because it isn't really prospectively studied, is whether I can titrate down the dose rather than stop the medication and stabilize the weight loss. And these are important studies that need to occur.
The idea of really having to stay on the medicines for the long term has certainly been the experience, but it's also coupled to the benefits, including the cardiovascular benefits. So it's just part of the process of saying, I want to maintain this weight and move on from there.
Right. And I think one of the easiest conversations to have around that for people with existing cardiovascular disease, so many of whom have hypertension, is if you stop your hypertension medicines, you will have hypertension again. And if you stop these cardioprotective medicines, you will have cardiovascular risk. And obesity is not something you treat one and done. Obesity is a chronic disease that people live with, and you don't just fix it and move on and it wouldn't recur. We don't stop statins, we don't stop hypertensive medicines, and we shouldn't stop these agents, but we might dose adjust.